Hello, how are you? Welcome to the WITN Nursing. In today's episode, you're going to learn about renal calculi. Renal calculi, as the name suggests, we have renal, which is the kidney, and calculi, which refer to stones. What are renal calculi? These refer to hard insoluble crystallite salts and minerals that have developed from the filtrate products of the nephron. These insoluble and hard crystallized salts and minerals may either remain in the kidney or even pass down in the urinary tract. In the pathophysiology of renal calculi, this is what happens. There is usually a normal balance between the solids and solvents in urine. By solute, I refer to salts and minerals. The solvent is the urine volume and also inhibitors. This normal balance is usually disturbed. Due to its disturbance, it leads to something known as supersaturation, that is, high concentration of stone-forming salts such as calcium, oxalates, uric acid, struvite, and even cysteine. These salt-forming stones later crystallize, leading to the stones, that is, the renal calculi. There are different types of renal calculi. We have nephrolithiasis that is located in the kidneys, ureterolithiasis located in the ureters, bladder calculi, as the name suggests, they are usually located in the bladder. The different types make us know that the calculi just not form in the kidneys, but they can also pass down to the ureter all the way to the bladder. From the pathophysiology, we got to know the different stone-forming salts. The first type of the renal calculi is the calcium. This usually forms due to excess phosphate or even oxalate in urine, and it is the most common one. The other type of renal calculi is the struvites that forms due to bacteria known as urine-producing bacterium. This bacteria usually occurs due to frequent UTIs or even chronic UTIs. Uric acid is also a type of renal calculi. This usually forms due to excess uric acid in the urine, and it may be due to protein diets, gout, or even dehydration. The last type of renal calculi is the cysteine. It forms due to excess cysteine in urine. Most of the times, people usually inherit this condition from the family. Risk factors of renal calculi. The first one is dehydration. Dehydration simply means less fluid in the body, which leads to less production of urine. Due to the less production of urine, the concentration of minerals tend to be high, leading to the supersaturation, hence forming the crystals. The other risk of renal calculi is diets. High sodium intake leads to increased calcium excretion in the urine, promoting calcium stones. High protein intake raises the uric acid and lowers the urine pH, leading to the uric acid stones. High protein in the diet also leads to decreased citrate, which is usually important in the prevention of stone formation. High oxalates combines with calcium, leading to calcium stones in the urinary system. We also have low calcium intake leads to increased oxalate absorption in the gut, and now due to the increased oxalate absorption in the gut, it again causes the calcium stones in forming. Lastly, low fluid intake, as explained in dehydration, it leads to formation of concentrated urine, which increases the supersaturation, hence crystal formation. Medical conditions can also put one at risk of renal calculi. Hyperparathyroidism leads to increased calcium in the blood and urine, hence formation of calcium stones. Gout increases uric acid, leading to uric acid stone formation. Chronic UTIs from the urus bacteria leads to the struvite stones. Some malabsorption disorders, such as the Crohn's disease, increases the oxalate absorption, hence causing more calcium stone formation. Diabetes mellitus, which causes insulin resistance and low pH, puts one at risk of increased uric acid, hence the uric acid stones. In family history, people inherit metabolic abnormalities such as cystinuria, that is, increased cystine in urine, hypercalciuria, that is, increased calcium in urine, and also the altered urine pH, which leads to the uric acid stone formation. Increased calcium leads to the calcium stone formation, and also cystine in urine leads to cystine stone formation. Renal calculi manifests itself in different ways. We have sudden and severe flank pain, and this is due to movement of the stone from the kidney to the ureter, leading to blockage of urine flow, hence sudden rise in pressure in the renal pelvis and the ureter. Nausea and vomiting. Severe pain stimulates the autonomic nervous system that triggers nausea and vomiting. Fever and chills. The stones can cause obstruction that leads to infection. That is, one can have obstructive pyelonephritis or even UTI that responds with fever accompanied with chills. Lastly, we have hematuria, that is, blood in urine. The calculi causes rough scratching and even irritates the lining of the urinary tract, hence leading to bleeding. Treatment of renal calculi. Percutaneous nephrolithotomy. This refers to an incision made on the back where the kidneys are and the stones are removed. We have the ureteral stent placements. A stent is usually placed to allow urine or even the stones to pass from the bladder to the ureter and out of the body, hence reducing the number of stones in the urinary tract. Then we have the extracorporeal shockwave lithotripsy, that is ESWL. The shock waves are sent to break down the stones. So this simply means that there is a certain wave that is sent to the kidneys or even the ureter or even the bladder to lead to the breakdown of the stone. The medication used in the treatment of renal calculi include analgesics, which simply reduce the pain that is caused by the blockage of urine. Antiemetics, these prevent nausea and vomiting. Antibiotics, mostly due to the infection that is usually caused by the renal calculi. Alpha blockers are also used in the treatment of renal calculi, such as the tamsulosin, alfuzosin, and doxazosin. They offer something known as medical expulsive therapy. The effects of alpha blockers are they reduce the ureteral spasms. This is because the stones usually cause irritation and spasms, hence leading to pain. Alpha blockers also widen the ureteral lumen, increasing the diameter of the ureter. Hence, the stones pass more easily. They also decrease the intraureteral pressure, relieving obstruction pressure, hence reduced pain. They increase stone expulsion rates, that is, the expulsion rates tend to increase more. They also reduce the analgesic need. This is because they lead to less spasm and colic, hence less pain. Yes, so alpha blockers not only give a direct treatment, but they also lead to reduction of the other symptoms such as pain. The nursing interventions include straining the urine, that is, keeping the stones and sending them to the lab for evaluation to enable us know the type of the renal calculi and its location. Number 2, encourage movements. Due to movements, it mostly leads to the repositioning of the stones. That is, it helps the stones to move, hence reducing infection. Encourage hydration by increasing fluid intake. Diet modification such as decreasing protein, sodium, and calcium intake. And lastly, monitor pain since it's the main symptom of renal calculi. Thank you so much for listening. See you in the next presentation. Like, comment, subscribe, and also share. Bye bye.